And now we're talking about other new modern devices that help the ear, nose, and throat surgeon do nasal surgery. Mark, you brought some tools with you. What in the world are those?
I think what I want to, my focus here is that this is a great time for the patient. We've moved a lot of things into the office now, which allows patients to avoid general anesthesia. They can drive themselves into the office. They can have a procedure to address their problem. They can drive themselves home. And so I brought a couple things that I'd like to show.
You can drive in and drive out.
And drive in, drive out.
Okay.
Under local anesthesia, we even have a nurse anesthetist who come to the office now who will give sedation for some people who want a little bit of edge off the anxiety, but most people do well just with plain old local anesthesia.
Do you spray the nose to deaden it when you do surgery?
You spray it, we put little cottonoids with medication to numb it, and sometimes inject a little bit, but after we've topically numbed it only do we use injection. It's very well tolerated. It's amazing what you can do. So I brought a couple things to show people. The first is a little handpiece that's a radio frequency probe.
Radio frequency.
Yeah, this emits radio frequency and we use it to shrink tissue in the nose. So for people who come in with very congested, stuffy noses, who don't have a deviated septum and really don't need a general anesthesia, this is a nice little tool to shrink the extra tissue in the nose.
How do you do that?
You just basically insert this probe into the soft tissue under local anesthesia and let the machine do the work. And it creates a little injury in the mucosa, and the body has a good enough immune system to resolve that injury and shrink things up, and people breathe again. Gets them off Afrin.
They must think that's a miracle.
Oh, it's a fabulous little simple procedure. It's changed the lives of so many of my patients.
And what's it called?
This is called turbinate reduction.
Turbinate reduction.
Yep.
Next tool?
So the next tool is a tool called Ryanair. It's again radio frequency technology. This little handpiece has some little spikes on the end of it. It's not sharp. You can see I'm pushing against my finger, but these transmit the radio frequency, and this can be used to shrink the turbinate or in the back of the nose to knock off a little nerve that causes some people to have excessive runny and drippy noses. A huge problem in our patients.
Everybody I know as they get older gets a runny nose, or some people get a runny nose and nobody can figure it out. This can maybe stop it?
Yeah. So, we treat people with medications, and most people do well with medication, but there are many who don't get better with medications, and this procedure is fabulous for that patient population.
What's it called again?
Ryanair.
Ryanair.
Yeah.
Rhine means nose, and air means we can open it up.
And that's the proprietary name. It's a radio frequency wand again. And then the last one is from the same company. It's a similar technology tool. Again, it's got the little teeth, if you will, on the end of it. They're not sharp, that emit radio frequency. And we use this in some people who have nasal valve collapse. In the front of the nostril, on the side walls, don't often have great architecture. And in some people, there will be collapse of the side wall of the nose. Nasal vestibular stenosis is what we call it in medicine. It's a big word for collapse. And this tool can provide some architectural support. So it again is under local anesthesia in the nostril, working just inside the nasal airway to try to bolster the strength and support of the side wall. And it works well additionally.
Is that a fairly new tool?
These are new tools, and these are things that have really changed the management in our patients.
I would think it's a phenomenal change that you have. So somebody has stuffy nose, can't breathe. If they've got a runny nose, and they're always dripping, and nobody can get it well, there's now getting to be advances that they can do that.
In the office, under local anesthesia, drive yourself home, which is humongous for our patients.